Hi folks, thanks for watching my monologue. As you may have heard, there's been a recent run on guns and ammunition. I just wanted to let you know that Guns Etc. is in a 10,200 square foot building which holds a lot of guns. So Guns Etc. is open and has a lot of product. Or you can go to gunsetc.com, that's gunsetc.com. And if you like my monologue, please subscribe to our channel using 960 The Patriot. Welcome back, April 17th, 2020. Some hard, perhaps counterintuitive facts. I'm quoting from Dr. Jonathan Geach's latest. He wrote, "The purpose of flattening the curve was to prevent the healthcare system from being overwhelmed with patients' sufferings from COVID-19. The reality is that the healthcare system is now underwhelmed, and healthcare workers are being laid off and furloughed in droves as a result of healthcare centers having neglected patient care not related to COVID-19 and fear of a COVID-19 surge that failed to materialize on a nationwide basis. This means tens of millions of patients are failing to receive the medical care they need in a timely manner. Almost every hospital outside of the hot spots is empty. The dramatic reduction in healthcare utilization and capacity is by no means limited to small country hospitals. Mayo Clinic is empty. 65% of the hospital beds at Mayo Clinic are empty, as are 75% of the operating rooms. This is the world's premier medical center. If Mayo Clinic is empty, imagine how dire the situation is at smaller community-based healthcare centers. Given the complexity of the patients referred to Mayo Clinic, its emptiness alone will have a significant negative impact on healthcare outcomes. Healthcare underutilization leads not only to patient care being delayed, which will likely result in deaths from delayed cancer diagnoses, it also leads to the loss of countless jobs in the healthcare industry, many of which will never return. Even if the patients that are not being seen at this time are seen several months in the future, many will suffer negative health outcomes. In medicine, timing is of the essence, and diagnosing and treating a patient today is more beneficial than diagnosing and treating the same patient for the same condition in the future. If the goal of the shutdown was to flatten the curve and prevent healthcare system utilization, why are we still under a shutdown when the healthcare system is significantly underutilized and tens of thousands of healthcare workers are being terminated and furloughed? Why are we still denying non-COVID-19 patients the care they need when hospitals are sitting idle and laying off staff in droves? The only surge we've seen thus far is with respect to initial weekly jobless claims. Tragically, there's a good chance we will see a surge in suicides later this year as well. A new study in the New England Journal of Medicine supports the claims that COVID-19 is much more common and mild than first believed. Researchers from Columbia University in Manhattan tested every woman who presented in labor for COVID-19 from March 22nd until April 4th. 15% of the women tested positive for COVID-19, but of these, 88% were totally asymptomatic. Also interesting, none of the women who tested positive were even sick enough to seek COVID-19 care. They simply came to the hospital to have a baby. Continued shutdowns threaten our economy, our health, and even our healthcare system. The state of our economy is not just a monetary risk, it is a health risk. When people lose their jobs, they typically lose their health insurance. The British Journal of Psychiatry found that there were more than 10,000 economic suicides as a result of the 2008 recession. Similarly, a 2016 study from The Lancet found that there were in excess of 260,000 cancer deaths as a result of the recession. These statistics also fail to mention the increased domestic violence, increased child abuse, substance abuse, and home loss when schools and businesses are closed. Thank you, Dr. Geach. I find it rather presumptuous, if not bumptious, that those who have done nothing other than write for a living presume to tell a lot of us who have been toiling in the fields of public health, mental health, and positive youth safety and outcomes for years that we don't care about life. Of course we do. All of it. What we find is things aren't easily siloed, and there are connections and nexuses between and among these things. As I put it yesterday, what risks come from closing the economy beyond financial? It's not small. Beyond the money taken out of the system, the literature is vast, and an easy web search reveals it all. The conclusion, unemployment is a driver and catalyst for a lot of health problems. For every 1% increase in unemployment, you can see a rise of 47,000 deaths, including 26,000 deaths from heart attacks, 1,200 from suicide, 831 murders, 635 deaths related to alcohol consumption, according to one study. Unemployment is strongly associated with suicide in 18 to 24-year-olds. Now, I realize some of these numbers may conflict amongst the different studies. Of course, so too do coronavirus projections. But what we know is one big thing. Unemployment alone raises death rates by the tens of thousands. That's not even talking about issues having to do with church and synagogue closings or school closings or free 12-step and rehab organization closings or strapped nonprofits that provide food and shelter closing or psychological effects from students having their daily life completely upended, including millions, not thousands, millions of children being removed from the one place they may be getting a solid meal or even just a solid adult in their daily lives. Are we ready for that? We aren't. So the drive and talk to reopen the country is more than ripe. I suppose what continues to fuddle are two things. One, why schools need to remain closed when we don't see this virus affecting our youth, except in the ancillary responses to the virus. And two, how quickly everyone immediately went along with hype and panic that sloped downwards before our very eyes, from predictions of millions of deaths here to far less. And yes, I know the critique. Because of our response, we sloped those numbers downward. I don't know that. Remember, the point was to help not overwhelm the healthcare system. And the models that jerked us from predictions of hundreds of thousands of deaths to 68,000 deaths included the very responses we undertook. Beyond that, the data doesn't make sense. California engaged stay-at-home orders 3 days before New York. California has 6% the per capita infection rate as New York. California has 3% per capita the mortality rate as New York. Florida instituted their orders 2 weeks after New York. Florida has 10% the per capita infection rate as New York. Florida yet has 4% the per capita mortality rate as New York from the coronavirus. The whole country is not New York. I understand the tendency and inclination to hype, to produce headlines, to present drama. It's not a good way to construct sound public policy, though. In fact, it's dangerous. That's why we abjure fanaticism, or should. That's why we abjure demagoguery, or should. It's why we abjure no redressability for grievances against our political leaders, or should. It's why we have a robust First Amendment, or should. It's why we limit powers here, or should. I'm reminded of Reinhold Niebuhr's line that man's capacity for justice makes democracy possible, but his inclination to injustice makes democracy necessary. George Washington offered the analogy that our system of government was designed to cool passions, as a saucer is meant to cool hot tea. So, could be outweighed the obvious foreseeable results. Could be, on one front, destroyed clearly what will be on many others. We accepted the possibility of one kind of catastrophe over the certainty of many other catastrophes. My fear is we will move on without the attention or resources to deal with that social fallout and destruction. Now is as good time as any to remind people of the actual purpose of politics and self-government. As Aristotle taught and put it, the task of citizens is the preservation of the partnership that is their system of government, the preservation of their community. Preservation of their community. Important phrase, that. One citizen differs from another, of course, he taught, but the salvation of the community is the common business of us all. Let's get to it. Indolence and waste are not healthy. Industriousness is a public virtue, as Bill Bennett likes to teach. It's a benefit to the general community. Benjamin Franklin and all of our founders understood this. As Franklin put it, industry and constant employment are great preservations of the morals and virtues of a nation. We know this in our personal lives. We should know it as a public good too, or commonweal. We were not meant to be idle. As John Witherspoon, James Madison's teacher, liked to warn his students, do not live useless and die contemptible. We struggle to let that not happen to our friends, don't we? Our children, or even our loved ones. We should be equally concerned about it with regard to our own community. I'm Seth Leibsohn. We'll be right back.